Imagine this moment. You reach the climax, that peak of intimacy and pleasure. Your body trembles, your heart races, your breathing becomes heavy. Everything feels familiar, everything feels right. It's a sensation you've known for decades. But then, a moment later, in the quiet afterglow, you look down and there's nothing. Not a single drop of semen. Just silence. The physical release was there, but the visible proof of it is gone. In its place, a flood of questions begins to rush in, each one more unsettling than the last. What just happened? Is something wrong with me? What would you think in that instant? Would you wonder if you're still the same man you've always been? Would you feel a quiet panic, a sense that your body has stopped responding the way it's supposed to, that it has somehow betrayed you? This moment of confusion, this feeling of loss, is a deeply personal and often isolating experience. But the truth is, it happens far more often than anyone talks about, especially for men over the age of 60. When it comes to health in our later years, we're comfortable discussing blood pressure, memory, our joints, and our diet. But there are some topics that remain shrouded in silence, and men's intimate health is one of them. For too long, this subject has been pushed into the shadows, leaving men to navigate their fears and uncertainties alone. Today, we're going to break that silence. This experience, known as dry ejaculation, is not a sign that you've lost your desire, your potency, or your virility. It is not the end of your intimate life. It is a message from your body, a signal that something has changed. And the most important thing to know is that, in the vast majority of cases, it has an explanation and, very often, it has a solution. In the next few minutes, we will walk together on a path of information and clarity. We are going to explore how normal ejaculation works, understand the changes that happen in a man's body after 60, and uncover the most common reasons why semen might disappear. Prepare yourself, because what I'm about to share may change the way you understand your masculinity, and it can restore the certainty that your desire, your pleasure, and your ability to enjoy intimacy have not come to an end. I have heard the whispered confessions firsthand. I have seen men, with voices trembling, tell me they avoid intimacy altogether, terrified of being discovered by their partners. Others hide it as if it were a fault, a shameful secret that proves something essential about their manhood has vanished. But what I want to talk about now is an aspect that, sometimes, hurts more than the physical symptom itself, the emotional and psychological impact of that silence. This isn't just about a physical change, it's about what that change represents in a man's mind. For many, the visible presence of semen has been a lifelong, tangible symbol of virility and function. When it disappears, it can feel like a part of your identity has been erased. The question, "Am I still a complete man?" echoes in the quiet moments, creating a profound sense of insecurity. The problem is that this experience, the dry orgasm, often triggers a vicious cycle. First comes the worry. Then, that worry turns into anxiety. You might start overthinking every intimate encounter, wondering if it will happen again. This performance anxiety can, by itself, create distance. The fear of being judged or questioned by a partner can lead men to pull away emotionally and physically, creating a rift in the relationship that wasn't there before. Many men fear their partner will think they are no longer attracted to them, or worse, that they are no longer capable of satisfying them. They invent excuses. They're tired, stressed from work, not feeling well, all to avoid a moment that now feels fraught with potential embarrassment. This silence doesn't solve the problem, it amplifies it. It builds walls where there was once connection. The anxiety leads to avoidance, the avoidance leads to distance, and the distance deepens the sense of isolation. What truly erodes a man's confidence isn't the lack of fluid, it's the silence that surrounds it. The anxiety, the frustration, and the sadness are real consequences of keeping this experience to yourself. That is why it is so crucial to understand this. A dry orgasm does not mean your desire has faded. It does not mean you have lost your ability to feel pleasure or to give pleasure. It is not a verdict on your masculinity. It is a physical signal, a message from your body that deserves to be understood and addressed, not hidden away in shame. Your value as a man, your virility, your very essence, is not measured in drops of fluid. And once you understand what is happening inside your body, you can reclaim your confidence and your peace of mind. To truly comprehend what happens during a dry orgasm, we first need to break down a very common myth, the belief that orgasm and ejaculation are the same thing. For most of a man's life, they happen together, so it's natural to think of them as a single event. But in reality, they are two separate processes orchestrated by different systems in your body. The orgasm is a neurological phenomenon. It is the intensely pleasurable sensation, the climax, that is centered in your brain and nervous system. Think of it as a powerful discharge of neural signals from the brain that produces a wave of pleasure, relaxation, and muscular contractions throughout the body. This is why you can still experience the full, intense feeling of an orgasm even if no semen is produced. The feeling part is still intact. Ejaculation, on the other hand, is a physical process, a mechanical function involving a series of coordinated actions by your glands and muscles. To make this easier to understand, imagine that the process of ejaculation is like a perfectly coordinated orchestra. In this orchestra, the testicles are the first violins, producing the sperm, the most essential notes of the composition. Next are the seminal vesicles, which you can think of as the entire string section. These small glands, located behind the bladder, produce the majority of the fluid in semen, more than 60% of the total volume. This fluid is rich in fructose and nutrients, and it provides the nourishing medium that gives semen its volume and consistency. Then comes the prostate gland, which acts as the brass section of our orchestra. It adds a special, milky fluid that protects the sperm and makes the semen more liquid, allowing the sperm to move more freely. Finally, you have the muscles of the pelvic floor and the reproductive tract. These are the percussion section, providing the powerful, rhythmic beat. At the moment of climax, these muscles contract forcefully, propelling the combined fluid from the testicles, seminal vesicles, and prostate out through the urethra. When everything is working in perfect harmony, the brain, our conductor, signals the start of the performance. The orgasm is the beautiful music that you feel, and the ejaculation is the sound the orchestra produces. The two are synchronized, creating a complete experience. So, what is a dry orgasm in the context of this orchestra? It means the conductor has given the cue, and the melody of the orgasm is playing beautifully. You still feel all the pleasure and intensity. However, one of the instruments in the physical orchestra is silent or playing incorrectly. The melody is there, but the physical sound, the semen, is missing or greatly reduced. This isn't a failure of the music itself, but a disruption in the mechanics of producing the sound. This brings us to the crucial question: which of these instruments can fall silent, and why does this happen, especially as we get older? This is, by far, the most common reason for a dry orgasm. The term retrograde simply means moving backward. In this case, during the moment of climax, the semen travels backward into the bladder instead of forward out of the urethra. Imagine a small gateway, or a muscular valve, located at the neck of your bladder. During a normal orgasm, this gateway is supposed to snap shut tightly. This action serves a critical purpose. It forces the semen to take the only open path, which is forward and out. In retrograde ejaculation, however, that gateway muscle doesn't close properly. It remains partially or fully open. As the powerful muscles contract to expel the semen, the fluid follows the path of least resistance and is redirected into the much larger, low-pressure space of the bladder. The sensation of the orgasm is still there because the muscular contractions are still happening, but the fluid goes in the wrong direction. While this can be alarming, it's important to know that retrograde ejaculation itself is not harmful. The semen mixes with the urine in your bladder and is harmlessly passed out the next time you urinate. So, why does this happen? The most frequent cause is a previous surgery on the prostate, such as a transurethral resection of the prostate, TURP, a common procedure for an enlarged prostate. These surgeries can sometimes damage the nerves or the muscle at the bladder neck. Certain medications can also be responsible, particularly alpha blockers used to treat high blood pressure, which are designed to relax muscles and can sometimes relax the bladder neck muscle too much. Finally, chronic conditions like poorly controlled diabetes can cause nerve damage over time, affecting the nerves that signal this muscle to close. The second major cause is a blockage. In this scenario, the semen isn't going backward, it's simply being prevented from reaching the urethra in the first place. Remember our orchestra analogy? This is like the string and brass sections producing their sounds, but the pathway from their sections to the main stage is blocked. The seminal vesicles produce most of the seminal fluid. If the tiny ducts that carry this fluid are obstructed, the total volume of semen can be dramatically reduced, sometimes to the point where nothing comes out. What can cause such a blockage? Often, it's the result of scarring from past infections, like prostatitis or even certain sexually transmitted infections that were not fully treated years ago. Previous surgeries in the pelvic region can also create internal scar tissue that obstructs these delicate tubes. In rarer cases, small stones, similar to kidney stones, can form in the seminal ducts, or a man might have congenital cysts that block the path. Unlike retrograde ejaculation, where the fluid is simply rerouted, an obstruction means the fluid is trapped. The third significant cause is related to hormones, and the main player here is testosterone. Think of testosterone as the conductor of the orchestra, responsible for ensuring that all the instruments are in tune and ready to play. It regulates the production of sperm in the testicles and influences the function of the prostate and seminal vesicles. As men age, it is a natural and normal process for testosterone levels to gradually decline. This is sometimes referred to as andropause. When testosterone levels fall, the production of seminal fluid can decrease. The seminal vesicles and the prostate may produce less fluid, leading to a much smaller volume of semen. In some men, this reduction is so significant that the ejaculation becomes dry, or very nearly dry. This is often accompanied by other signs of low testosterone, such as fatigue, a loss of muscle mass, and a reduced libido. Furthermore, chronic diseases like long-term diabetes and hypertension don't just affect the bladder neck. They can also damage the nerves and blood vessels throughout the entire reproductive system. Over many years, this can impair the function of the glands that produce semen and the muscles that expel it. So, in this case, the dry ejaculation is not a sudden event, but a gradual change that reflects the natural aging process of the body, often accelerated by these chronic conditions. While dry ejaculation is frequently benign and often linked to aging or previous medical procedures, it can also be a crucial warning sign that something more serious is happening in your body. It's vital to listen to these signals, because ignoring them can allow a manageable issue to become a major health problem. Here are the specific warning signs that should prompt you to seek medical help immediately. The first is a sudden, unexplained onset. If you have been ejaculating normally for your entire life, and then, from one day to the next, you experience a completely dry orgasm without any clear reason, such as starting a new medication or having had recent surgery, this is a signal that needs to be investigated. The body rarely makes such an abrupt change without an underlying cause. The second alert is pain. Pleasure should never be painful. If your dry orgasms are accompanied by any discomfort, pressure, or a burning sensation during the climax, or if you feel a persistent ache in your pelvic region, this is not normal. Pain can indicate infections, inflammation, or blockages that require medical treatment. The third sign, and one that requires immediate attention, is the presence of blood in your urine or semen. Even if it's just a small amount, and even if it only happens once, this is a red flag. Blood can be a symptom of a wide range of issues, from simple infections to more serious conditions affecting the prostate or bladder, including prostate cancer. Never ignore this symptom. Another serious warning sign is when dry ejaculation is accompanied by other neurological symptoms. Pay close attention if you notice weakness in your legs, a loss of sensation or numbness in your intimate area, or new and sudden problems controlling your urination. These symptoms could indicate that a neurological condition is affecting the nerves that control both your reproductive and urinary systems. Finally, if you experience a persistent fever, chills, or a prolonged feeling of being unwell along with dry ejaculation, your body may be fighting an infection, such as prostatitis, which is an inflammation of the prostate gland. These systemic symptoms, combined with a change in your ejaculation, are a clear signal to consult a doctor. If you have experienced any of these warning signs, do not hesitate. Make an appointment with your doctor or a urologist as soon as possible. Acting in time can be the difference between a simple solution and a serious problem that compromises your health in your later years. After acknowledging the issue and recognizing the importance of seeking help, the next step is to explore the solutions. Fortunately, modern medicine offers a range of effective strategies for diagnosing and managing dry ejaculation. Let's break down the path to recovery into clear, actionable steps. The first and most critical step is to get an accurate diagnosis. Nothing can improve if we don't know exactly what is happening. A urologist will typically start with a few simple, non-invasive tests to pinpoint the cause. A post-orgasm urine test is a straightforward way to confirm retrograde ejaculation. This involves providing a urine sample shortly after a climax. If sperm are found in the urine, it's a clear sign that the semen is being redirected into the bladder. Another valuable tool is a transrectal ultrasound. This imaging test allows the doctor to see the prostate and seminal vesicles in detail, revealing any potential obstructions like cysts, stones, or scar tissue that might be blocking the ducts. Finally, a comprehensive hormone panel is essential. This is a blood test that measures your testosterone levels, along with other key hormones. It can quickly determine if a hormonal imbalance is contributing to the low volume of semen. These initial studies are fast, accessible, and bring clarity where there was once only doubt. Once the cause is identified, the treatment can be tailored to your specific situation. If retrograde ejaculation is confirmed and is being caused by a medication, your doctor might be able to adjust your prescription or switch you to an alternative that doesn't have the same side effect. If the cause is a weak bladder or neck muscle, certain medications can be prescribed to help strengthen that muscle and ensure it closes properly during orgasm. If an obstruction is found, the solution might involve a minor surgical procedure. Endoscopic surgery, for example, allows a surgeon to use a tiny camera and instruments to clear blockages in the seminal ducts without major incisions. In cases where the cause is hormonal, testosterone replacement therapy, TRT, can be a life-changing solution. This therapy can be administered as a gel, a patch, or through injections, and it works to restore your testosterone levels. This not only can improve the volume of your semen, but also boost your energy, desire, and overall sense of well-being. It is crucial, however, that TRT is always done under strict medical supervision, as each case requires a personalized plan. The third solution lies in your daily habits. Your intimate health is directly connected to your overall health. There are 3 fundamental pillars to focus on. First, if you have chronic conditions like diabetes or hypertension, keeping them under control is vital. Managing your blood sugar and blood pressure protects the delicate nerves and blood vessels that are essential for ejaculation. Second, regular exercise, particularly exercises that strengthen the pelvic floor muscles, can significantly improve your ejaculatory control. A well-balanced diet, rich in fruits, vegetables, fish, and olive oil, protects the prostate and improves hormonal quality. Finally, getting enough sleep is a detail that many underestimate. Quality sleep regulates hormones and reduces stress, both of which are key factors in your intimate health. Finally, we cannot forget the emotional solution. The most powerful tool you have is communication. Talking openly with your partner about what's happening can be uncomfortable at first, but it almost always brings relief. When a partner understands the medical reasons behind the change, fear and insecurity are often replaced with empathy and a desire to support. If the anxiety or the impact on your relationship feels overwhelming, seeking support from a professional specializing in sexual health can be liberating. You are not alone in this. More and more men in their later years are consulting specialists about dry ejaculation, and every conversation opens doors to solutions and to a better quality of life. Remember, silence doesn't heal, communication does. And speaking of solutions, I want to share something truly remarkable that addresses a closely related issue many men over 60 face. We've talked about how factors like hormones, circulation, and the natural aging process can affect ejaculation. Well, those same factors are often the root cause of another major concern, the ability to achieve and maintain a strong, firm erection. If you've ever felt that your soldier isn't as full, firm, or sensitive as it used to be, then you need to stop what you're doing and pay close attention. There is a bizarrely simple, 100% natural 7-second home remedy that is helping thousands of men restore the powerful, rock-solid erections of their youth. This isn't about risky pills or injections. It's a breakthrough method that targets the real scientific root cause of male performance issues. To discover this life-changing technique for yourself, point your phone's camera at the QR code you see on the screen right now. It will take you directly to a short, eye-opening video that explains everything. If you're watching on a mobile device, you can also find the direct link pinned at the very top of the comment section below this video. Don't let another day go by feeling frustrated or anxious. Take a moment to see this for yourself. I want to close our journey today with a clear and direct message. Dry ejaculation is not the end of your intimate life. It is not a sentence, and it does not mean your masculinity has faded. It is simply a signal that your body is sending, a message that needs to be heard and understood. I have seen countless men over 60 go through this experience. They all shared the same fear, silence, and shame. But I have also seen them rediscover their confidence and joy in intimacy once they understood what was truly happening. Your body still responds. Your desire remains alive. And your capacity to enjoy pleasure has no expiration date. That's why I invite you today to take one more step. If this message resonated with you, break the silence. Talk to your partner, consult a specialist, and take action. Your intimate life can continue to be satisfying and fulfilling well after 60. The decision is in your hands.